Loving living local. This morning we're chatting with the Shandy Clinic. They're a private therapy practice that specializes in individual therapy, and this morning we're talking to Assistant Director of Physical Therapy, Dr. Nichole Losse, about how physical therapy can impact a child's development. Good morning to you, Doctor.
Good morning. Thanks for having me.
Of course. Well, as a parent, this is an important topic. Can you give us an overview of the physical therapy department over at Shandy Clinic?
Yeah, so we focus on treating the whole child at the Shandy Clinic. We work really closely with the families from the beginning, and we work on unlocking the full potential of their child. So we work from the beginning to work on your goals and your concerns, and just to make sure we're all on the same page to work together to help this kiddo. And then from there, we work on treatment, which is where the fun begins because it's in one of our amazing play structures, and we just have fun. So it's really great.
Of course. And at the end of the day, it's doing something good for that child. What makes the Shandy Clinic stand out in terms of the physical therapy services provided?
So we have really wonderful physical therapists. They're not only highly qualified, but they demonstrate our core values each and every day. They really work hard to establish really great rapport with their patients and families, and it's really obvious that they love what they do. And then besides our amazing PT staff, we have amazing facilities. We have beautiful gyms that make doing physical therapy feel like they're just playing. And then we also have great equipment for our orthopedic program to help with those kinds of injuries.
That's awesome. And you know, any strategies you can use to keep that child happy is key here. Why might a child need physical therapy?
So there's many reasons why an infant, child, or adolescent might need physical therapy. It could be just that reduced strength, that poor endurance. Maybe they just seem a little bit clumsier than their peers. A lot of times parents will say when they watch their kid on the playground or at school, they just seem a little bit doing things a little bit differently than their peers. So it's just those gross motor skills we need to work on. Or it could be for those orthopedic reasons that you kind of think of when you think of physical therapy. So those physical injuries that may happen.
Of course. Now we're living in interesting times, and a lot of doctors are using teletherapy as a way to treat their patients. How has this worked for you guys? Is it the same or possibly even better than in-person therapy?
So I've seen amazing results with teletherapy with my patients. I've either seen the same results or a lot of times even better. I've been very excited to see like our home exercises, our PT in general, just the carryover with the families, because they can see now like it's so easy just to do in their homes. You don't need fancy equipment, and it's just been so fun to empower those families to say like, you're the true hero in this story. You're the one that's helping your kid. I'm just here to help facilitate it. So it's really helped with teletherapy to demonstrate that. So I've really enjoyed it.
So one more question is, when a parent senses there's something wrong, does somebody need to refer a child to you guys, or can a parent basically come in and say, hey, my child may need physical therapy?
Usually it's a good idea first to go to your physician just to get that referral over to us, and then our referrals team will move it through the system and give you guys a call to get that appointment scheduled.
Okay, well, easy enough, and sounds like you guys are doing great things. Thank you so much, Doctor, for being with us this morning. It's the Shandy Clinic, and again, we'll be talking to you soon, but for now, I'm going to give everybody more information. ShandyClinic.com for more.